Specialty care shouldn't require months-long wait times or geographic limitations. Our next guest, AJ Patel, is revolutionizing this approach as CEO of Telemed2U. With over 20 years of healthcare operations experience spanning drugstore chains and specialty pharmacy environments, AJ brings a unique perspective to virtual specialty care delivery. Having navigated Telemed2U through significant growth and technological transformation over the past 6 years, he's built a network of 500-plus providers across 20 specialties nationwide. Driven by a passion for breaking down geographic barriers and eliminating lengthy wait times, AJ shares how Telemed2U is democratizing access to specialty care through innovative virtual solutions. Join us to discover how this technology-enabled platform is connecting patients with expert care, regardless of location, transforming outcomes through collaborative medicine, and reshaping the future of specialty healthcare delivery. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, AJ. A big welcome to our podcast today. I'm so excited to have you on.
It's a true pleasure, Mike. I look forward to the conversation and sharing our journey at Telemed2U.
Well, given your extensive experience leading healthcare operations across drugstore and specialty pharmacy environments over the past 20 years, and your passion for breaking down traditional barriers to specialty care through your leadership at Telemed2U, I'm really looking forward to this exciting conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, AJ, it's almost time for our community to learn how you and the Telemed2U team are pioneering accessible specialty healthcare through your technology-enabled platform that connects patients to over 500 providers across 20 specialties nationwide, and eliminating geographic limitations and reducing wait times. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Great, Mike. That's a fantastic question. I think, I'll start by saying we need to start treating healthcare for human beings similar to how we treat our cars. And what I mean by that is investing in proactive care to minimize the potential of downstream effects. And I think we just don't invest and innovate enough in proactive care and spend a lot of our time reactively, which is what really brings us to chronic care management that we do at Telemed2U.
Well, I think this is a first after 300 plus episodes that we are talking cars and automotives on this podcast episode. But jokes aside, AJ, I love the analogy, right? I know I get my oil changed today. I know exactly the next time I've already got the next one scheduled. I know I'm on the schedules for those 5, 10, 15, 20,000 mile tune-ups. Why can't we apply that to our own selves on our own care journey? AJ, I love that. And from your perspective, and maybe we can dive a bit more into what you and the team are doing exactly around that at Telemed2U. But from your perspective, if we looked at it through that lens of how we operate with our cars, what do you think some of those outputs would be on the macro for our industry?
Yeah, I can love to build on it. So if we think about that proactive care aspect, we do it right on childbirth. We do it probably through the first 3 to 5 years of life really, really well through this scheduled pediatric visits. And then it starts to dissipate a little bit from that point on. So perhaps the first step would be to just continue what we do through the age of 12 or 13 and continue that same level of cadence and touch points through the teenage years and early adulthood and beyond. And in today's day and age, I'll use this example that's near and dear to me. Come from a family where diabetes, unfortunately, runs in the genes. My cousin, who is a diabetic at an early age, hadn't really heard about CGM and to use glucose monitors. And I got him onto an an over-the-counter version called Lingo, and he purchased it. And 2 weeks after he started using it, I got a text going, that first week, I was having 5 to 6 spikes a day. And from what I saw, the behaviors that were leading to those spikes, he was able to correct them. And then on the second week onwards, he had 0 to 1 spike per day. This was a casual conversation over a routine touch point. And there are hundreds, if not thousands, if not millions of people out there that are in the same shoes. And then he went in a month or two later to his primary care vet or I guess an endocrinologist visit and was told that he wasn't eligible to get into his insurance because of the type of diabetes or what have you, right? So I think that's where the investment piece comes in. So that's just one basic example of where our healthcare ecosystem could proactively invest in the basic elements of where technology has landed today. And I think you could do the same thing in the areas of cardiology and other spaces where there is advent of technology that will help diagnose a coronary artery blockage well in advance of an ill event. And there are an array of different things that can be done. And I'll speak a little bit more about that later in the conversation.
Well, I absolutely love that, AJ. And of course, you just briefly mentioned this notion of touch points. I absolutely love that word and kind of how we think about that. And we're going to discuss how you and the team at Telemed2U are creating and somewhat democratizing this notion of touch points and giving that access to folks across the nation with your incredible network of clinicians. We're going to discuss all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we were back with AJ Patel, President and Chief Executive Officer at Telemed2U. AJ, thank you so much for really setting the stage on the front end. I love this notion of touch points. I love this notion of being proactive. And like I said, first time we've ever talked about cars on the podcast. So love that as well. AJ, we're going to dive in. We have a lot to discuss. You've now been at Telemed2U for about over 6 years. Company's been around for a little over 14. So a lot to discuss there. How it all came to be for you joining up with the team at Telemed2U. And of course, we've got to ask, how are things going today? Where are you seeing those opportunities at this time to continue to push Telemed2U across the nation? Then, of course, we've got to look a little future state. Where do you see things heading, not only on the macro for the industry writ large, but of course, where is Telemed2U going to be as well? And then, of course, we can't let you get out of here until we can figure out ways to be helping you and your team out with the incredible community we have rallied around the podcast. But before we get to all of that, of course, AJ, give us a little bit of a history lesson. How did it come to be, your time in healthcare, and then how did Telemed2U start coming into focus a little over 6 years ago for you?
Love to share my personal journey. Mike, I grew up in a family of physicians, mom, dad, grandfather, aunts, uncles, cousins. But when I was embarking on my journey in high school, I really had a passion for business and creating solutions for common day problems. And then I also had this inkling of staying somewhat true to the healthcare universe. And I ended up going to pharmacy school. So I went Texas Longhorn. I went to the University of Texas at Austin College of Pharmacy. And through that journey, assimilated a ton of clinical knowledge. But as I was going through the curriculum, one thing was for certain for me was to be able to graduate and learn how to provide clinical care, but to also find a way to ensure that whatever skills I have amassed can be expanded to a wider population. So started my career at a prominent drugstore chain, recently went private, and went through various realms of leadership, starting out as a pharmacist and, managed a singular drugstore unit. As the years went on, I helped support everything from our governmental and regulatory affairs matters in Texas to new store development, incorporating a specialty pharmacy division, healthcare clinics into some of our sites. And right before I left, I managed the Central, East, and West Texas operations that were related to our drugstore and specialty pharmacy side of the house. In that journey, I learned how to scale a business. I learned how laws, regulations affect healthcare. I learned how to navigate the hurdles of technology implementations and what have you. But what I felt incomplete with was I was still only focused on one half of the equation of healthcare, right? That starts from the point a provider prescribes a treatment plan, and everything I did for 20 years was focused on that prescription onwards. And in those latter years of my time at Walgreens, I was also an LP at a venture firm, Manata Ventures out of Sacramento, and they have a Texas office. And as one of their healthcare background LPs, I would get calls to help support them with diligence around any of their healthcare investments that they were looking at. And at the tail end of 2018, they were looking to bring a telepharmacy company and combine it with their small investment at Telemed2U, and then kind of create this combined healthcare arm that they thought would be a good fit. And they started bringing conversations with me in early 2019 to come in and run the combined entity alongside the respective founders of both arms. And that's how we started our initial conversations. And one of the former larger investors into the Manata fund that had the stake in Telemed2U is a gentleman by the name of Kevin Nagel, who was a co-founder of the PBM that got acquired by Rite Aid. And, was very familiar with the healthcare ecosystem. And he also had some connects at Walgreens, did his own back channeling on who I was and what I'd done. And a few months later, they reached out and wanted to offer me a job, not to take over the combined entity. That transaction had some hurdles and never went through to acquire the telepharmacy company, but they wanted to see if I would join them at this journey that they had began at Telemed2U and really help scale it. Because while it had been around for 5 or 6 years, the venture firm was looking to take majority control because they really saw this, and we're talking 2018, right, when telehealth wasn't a household word yet, but they saw a future for telehealth in the coming decade. And they were ready to double down, take majority control, wanted to make a small change in leadership. So I replaced one of the co-founders. The other co-founder is still with us. He's been an instrumental part of this journey till date, Dr. Javed Siddiqui, who is our chief medical officer. But that led to me joining the company. And when I arrived, and this was kind of, you described the messy middle, I'd call this the messy middle in Telemed2U's 14-year journey. So it's now about a 20-person company. They're beyond the proof of concept. They've got a large managed Medicaid plan at this time that covered about 500,000 lives in Northern California across a lot of rural counties. And Telemed2U was the selected virtual specialty care provider, along with providing care for about 40 different prison facilities to help reduce their need to transport prisoners and bring specialty care to the sites virtually. So they had really proven out the model. They had revenues, they had real customers, but we were at the juncture of how do you scale a company solely based on contract physicians? Because you can only go so far at the mercy of somebody who might have a day job at a hospital or at their private practice, and then they're offering 4 hours a week. So amongst a variety of different strategical elements that I kind of created in our roadmap in my first year, one of the top strategic priorities was to really start building out the clinical bench strength. And that meant we needed to bring on full-time board certified specialists that were part of the team that would sit alongside Dr. Siddiqui and I and help ideate on our future roadmap. And when you talk about those challenges, the messy middle, as you described it, convincing a board certified specialist that might be tenured at a health system, providing hands-on patient care, to jump on a leap of faith to join a 20-person virtual care company that's been delivering specialty care for about 5 years and given up all their experience at the prior system. It was tough to get our first and then our second and our third. But we eventually started gaining some traction. There were people out there that wanted to be a part of the organization that was disruptive and innovative in nature. And one of the first instrumental clinicians we brought on board came from a large national payer-run medical organization and was really frustrated in the lack of innovation on rendering care. And until today, he's one of our most innovative contributors. But as that journey was just taking traction, we got some tailwinds from COVID, right? COVID happened. And what COVID did for us, unlike what it did for probably a lot of urgent primary care type organizations where they saw astronomical surges in revenue, we actually got headwinds because as a specialty care organization, we work off of referrals. And guess what happened? People weren't going into a PCP for, diabetes or what have you, anything that wasn't critical. So our referrals went down. We also serve hospitals, and hospitals weren't doing any procedural work. So they didn't need virtual infectious disease consults post-surgery or what have you, right? So we actually saw some revenue headwinds, but the clinician mindset shift. So what was very specific to certain individuals that were open-minded and actually saw the advent of delivering specialty care virtually, we just saw a springboard effect after that, where almost every endocrinologist out there recognized that what they largely did was data-driven through labs and images, patient history, and their practice would almost entirely be done virtually. I say almost entirely because you're still going to have certain procedural work done or, thyroid taps or what have you. But we started to get traction. Our phone started ringing. We had people who wanted to join the organization, and we started doubling down on taking advantage of the interest and started building out our team. And till date, we have W-2 team members, and then we have contract clinicians, and it'll always be a blended model. But we really started ramping providers that were full-time committed to the company. That juncture, so we stayed on that trajectory, but we then started really focusing on ways to deliver the care in the most optimal manner. And what's interesting is I'll talk about our technology journey. So we actually went down the road of building out our own technology stack because at the time, the legacy systems weren't designed for virtual care delivery. And I say at the time, meaning 2020, 2021-ish, right? But I'll fast forward. I was listening to one of your prior podcasts, and your guest, Dr. Lyle Berkowitz, actually spoke to this very point. And he talked about companies that went down this technology path and really spent a ton of dollars, time, and energy, and really wasn't the strategically right decision. And I'll say this, he was 100% on point, because prior to the date of his podcast with you, we had already made a strategic decision to sunset our proprietary stack after 4 years and millions of dollars and tons of time and effort. And I was hired as a operations CEO. I'm not a technology guy, right? And yet found myself running both a medical services company and a technology company. And it had its benefits. Don't get me wrong. We built something beautiful that was very purposefully designed for delivering virtual care. We didn't need the 5,000 features that the legacy stacks had. But what we realized is we need to stay focused to our true North Star, which is delivering quality patient care with measured outcomes. And yes, we'll have technology layers around it, but we don't need to own our stack. So we made that transition. So I'll still call that part of that messy middle, if you will, right? Capital deployed, time, effort deployed, that ultimately didn't resonate. But we've since pivoted, and we've elected to move. We have already migrated our entire all business lines to Advanced ND there as our platform. We'll continue to build experience layers around it to provide either client-specific or primarily client-specific layers of patient portals and other avenues that we offer to our enterprise clients. So that's kind of the messy middle, but a lot of learnings came out of it that still continue to work for us today, that we feel like we actually tried different paths and arrived at where we were at after having learned the pros and cons of what worked.
Well, heck of a journey for sure. And thank you for outlining that. It really brings to light and brings to bear some of those decisions that need to be made, even after making, like you said, multi-million-dollar investments. But those are some of the things, as you continue to build and try to innovate within healthcare, those are the things that just need to happen at times. But you also briefly mentioned, and I know we'll talk more about this here in just a moment, around the notion of patient outcomes, et cetera. Let's go there. And let's also talk about this notion of breaking down geographic barriers through technologies. And as well as I do, AJ, and of course your clinicians know this as well, that patients are often waiting months to see specialists in their local markets. And so when we start thinking about that reality, how does Telemed to Use model specifically address network adequacy issues? And what impact have you and the team seen on patient outcomes when care is delivered more promptly?
Great question. So I think we've seen great results. So first and foremost, I think as we talk about network adequacy and we talk about breaking down the barriers, the beautiful part about virtual care is agnostic to where the provider resides. You have to get them licensed and credentialed and payer enrolled across the geographies that they need to serve. And we largely do it based on our demand pool, whether it's through an enterprise client relationship or where we're getting patient demand from. So, believe it or not, we've got probably about 3 to 5 providers that live in Hawaii and serve patients in the mainland, right, with their multiple licenses. So we're able to be more efficient, if you will, in balancing demand with capacity and managing license expansion as needed. I often internally operationally refer to it as the hub and spoke model, where we'll have clinicians centered around an anchor client in a particular state, but then we'll expand licenses in that time zone geographically so that when we do get maybe not as much patient traffic as they're getting in the hub state, they're able to service the spoke states. And we can add advanced practitioners as well to support our board certified specialists for follow-on care and stuff. And then that's how we really are able to leverage and manage capacity expansion. The technology and the collaborative care, I think what our unique model brings to the table is these 20 medical specialties, and many of them have cross currents. So if you think about a newly diagnosed diabetic, right, that's referred to us because the PCP either doesn't want to manage, key primary care providers are overwhelmed and sometimes just either don't want to manage a particular disease state, or they haven't had traction with their first line treatments, whether it's metformin or some other baseline diabetes treatment drug. So they come into us. So we now have a patient that's been told that they have a disease that is going to probably be with them for the rest of their lives, right? So you automatically have a mental health component that's often overlooked because we're so focused on the diabetes, right? You might have nutritional challenges that's leading to some of that. So we're able to offer nutritionist support. We might have to have them on a particular regimen and they need a diabetes educator on injecting insulin or adjusting their pumps or what have you. And an organization like ours can seamlessly bring this paradigm of care together without having to have the patient run from one healthcare system to another and trying to coordinate all his appointments that are often very difficult to get. And then all of the results from those visits end up in a central place, and it enables the physicians to see each other's clinical notes and treatment plans. Now, while the HIEs allow that to a certain degree, I think we're far from true data sharing, even when people are working within one ecosystem. I'll use my own personal example. I saw a particular specialist in a system that was on Epic, on the West Coast, and I moved back to Austin. And when they scheduled my appointment, they thought they'll have everything because they asked me where I used to go. And when I showed up to that visit, the clinician spent half the visit getting history from me because they pull any records, right? It just wasn't there. So it's not a perfect ecosystem unless the entire care team is charting in the same particular instance of that EMR. So we're able to offer this collaborative care model where the patient's always at the center, and then we can determine what type of care they need to be referred into. The cross currents between endocrinology and rheumatology, oftentimes between medical rehabilitation and neurology, oftentimes for certain types of nerve pain. So there's a lot more cross-pollination and collaboration that's possible. And we're able to bring that all digitally. So from an example perspective, I'll share the following. One of our customers is Blue Shield of California, and they launched a pretty novel product called Virtual First. It's a Virtual First health plan. It's actually called Virtual Blue, but it's a Virtual First health plan. And from what I was told, this was really the first innovation in a health plan product offering since the advent of the PPO plan that came after the HMO plan. And this particular product is similar to a PPO plan, except at enrollment, the members are assigned a virtual primary care physician, and then they start with a virtual network of specialists that telemedicine to you. And particular patient story that was shared with me, our endocrinologist identified a particular type of tumor or cancer in a patient all through history taking over multiple visits that had gotten missed after months, if not over a year worth of visits at a pretty renowned national health delivery system. And the difference when I talked to this particular clinician, because when the story was shared internally as a successful outcome, the clinician said it was largely about connecting the dots of being able to take the time to listen to this person intently, and led to a phenomenal outcome, right? In the sense that unfortunate diagnosis, but a phenomenal outcome versus it going undiagnosed, right? We can share examples around hepatitis C. Our chief medical officer is also an ID doc, and we've published some studies around cost reduction and better treatment outcomes on Hep C populations, right? Because we're able to tightly manage and control and monitor, manage very controlled in a controlled environment, and we're able to work with the formularies that are provided by the payers, and we just are able to do it more effectively in a virtual setting where you have all the data points coming to you on a constant basis. So I think the virtual care model is not for everything. There needs to be a mechanism, and there needs to be a process by which clinicians recognize when they need a handoff or a referral back into an in-person visit. But it's kind of like a 60-40, 70-30 rule where we are able to support an already stressed health delivery system nationally that has the long wait times that you mentioned, by taking off the hands of those, in-person brick and mortar specialists, the cases that can be handled virtually or managed virtually post-procedure, et cetera. So I think the network inadequacy challenges that the nation faces today, especially in specialty care, is so huge to where this is not about market share gains or one organization trying to capitalize at somebody else's cost. I think it's really playing on a team together in terms of identifying plays that we can run better than the plays a brick and mortar health system can run better, right? And working collaborative.
Yeah, I couldn't agree more. We are at mission critical in regards to the needs of folks across this nation. And of course, AJ, let's also look a little at future state as well. And looking ahead, what trends do you and the team see shaping the specialty healthcare landscape? And of course, how is Telemed2U positioning itself to continue pioneering accessible, high quality specialty care nationwide?
So first and foremost, I think it's the simplest part, but also complex, which is just continuing to add quality clinicians to our network so we can add capacity to be able to serve and maintain our short wait times to receiving appointments and helping the patient with prevent downstream harmful effects. That's continued to scale, and we've been fortunate to have a private equity backer as of last year. Our original sponsor, the venture cap firm, exited to a private equity firm, and we're well capitalized to continue to invest in both clinical expansion of our network and then technology as needed to ensure that we're delivering very measured care. So that's the second piece. I think payment models have to evolve, incentivizing provider orgs to get reimbursed by having just basic touch points with patients or getting them on treatment plans, getting them started on treatment plans that, irregardless of outcomes, will have to start shifting. I think providers have to be accountable for outcomes, and that will help drive better collaboration of care. It'll help drive better data sharing so that we're reducing duplicative tests and labs and imaging and all of that really should be shared in a much better cohesive format. So measurement-based reimbursement models, I think, are inevitable because the payers are stressed, their expenses are going up, and then ultimately it's the right thing for the patients. And how do we do that? I think kind of goes back to the beginning of the conversation. I think connected care will allow us to have the measurements we need, and there's rapid innovation in that space. I think in 2025, probably third to a half of the U.S. population should be supplied CGM from their insurance company, right? Because it's going to help pre-diabetics as well as diabetics and help all these downstream. So I think smart watches and calibrating physical activity, sleep patterns, heart rates. I love sharing the examples, and I'll share another one that I heard last week from a neighbor. I live in a high-rise in Austin, and one of our neighbors that I hadn't seen in a while and learned that he was diagnosed with cancer and is going through treatment at MD Anderson and all of that. But once we got into the crux of the conversation, his initial trigger was his Apple Watch alerting him that his heart rate had dropped below the baseline twice over a 1-week period. And that got him to that first cardiology visit that led to something else, that led to something else. And a week and a half later, he was getting the right tests to identify that it was actually cancer. Now, could that have eventually been found? Sure. But I don't think he would have ended up going to that cardiologist if he didn't have that alert. He was feeling just fine, right? His feeling was fine. So I think measurement-based care that comes through a connected care universe and having real-time data at the point of care for our clinicians, that's absolutely a must. I think we know that the AI innovation is off to a rampant start, but I think healthcare is still lagging in terms of how actual utility of that is presented for the clinician. I see summarized data. I see summarized historic clinical notes, maybe even an AI first stab at interpretation and diagnosis for clinicians. Those things have to come. And I understand there's regulations and we've got privacy to figure out. And we will. It's inevitable because clinicians are clearly burnt out on documentation and data overload, right? So how do we better summarize the data that exists for them? I think the other critical things that will come soon is transition of care. So when we talk about hospital at home, which I think the VA's pioneered with and had some tremendous success, how do we start decreasing inpatient stays with a well-planned and executed transition of care to the patient's home? And virtual specialty care organizations are going to be a part of that equation, right, with home health and nursing and others. So I think transition of care is going to, in an aging population, we're going to have more and more off that. And we need to make sure that the hospital beds we have today are available for the acute cases. So these are just a handful of a plethora of things that I think will have to evolve. And the last one I will say, especially coming from somebody that's responsible for a virtual care organization, is the omni-channel approach. And I truly envision a world where if I'm a cardiologist delivering care virtually and I have a patient that needs an echo done or needs an EKG, for me to be able to better assess and identify what's occurring, they should be able to go to a center somewhere close to them that has a medical assistant or equivalent leveled team member that's able to run those tests and transmit them to the ordering clinician within minutes or hours. And then you continue that, right? So virtual doesn't have to mean virtual only. It's got to have a future where there should be co-shared centers in every geographic area, especially the rural communities. I think the rural communities that we serve extensively, because a lot of our clients come calling us because they're in a rural area, they don't have access to any specialty. Those are probably areas that could benefit for something like that at first. And coming from my previous world, there is a pharmacy within a few miles of every American. What a great way to get certain types of diagnostic devices and equipment into pharmacies. Pharmacies are also staffed with pharmacy technicians that in most states have level of certification and medical training, including providing immunization. So I think the world's going to have to evolve, and we'd love to be a big part of that change.
And then bringing it back to kind of current state as well, AJ, because as I mentioned on the front end, we have an amazing community rallied around this podcast. What's one problem, need, or question that you and the team have that our community can be helping you with?
Yeah, so we've been able to really expand and grow through our enterprise relationships, albeit at a gradual pace, but we've done wonderful things for enterprise clients. But we're also, one click away from any American that needs access to these specialty services, specialty care services. So I think if any listener has a family member or loved one, a friend that has been stuck in the system and not able to get the care they need, it would be great for a referral to tell about to you and help us expand awareness of the brand. And we'd love to someday become a household name for virtual specialty care, just as other organizations are for urgent and primary care. So, and then for any other enterprise listener, if we're not already working with your organization, we'd love to have an opportunity to understand how we might be able to serve you better.
And for our community members that would love to have that conversation with you, how do they get a hold of you online, social media handles, websites, or otherwise? How do they track you down?
Yeah, absolutely. www.telemed2u.com. If you want to email us, it's info@telemed2u.com. Also on Instagram and Facebook @telemed2u, LinkedIn as well. And personally, if anyone wants to have any dialogue with me, it's AJ Patel @telemed2u.com. Feel free to email me and would love to help understand what you need.
Excellent. For our listening community, you can simply scroll on down into your favorite podcast player where you're accessing this episode to get all those contact points for AJ and the team. Or you could head over to our free global online community at passionatepioneers.com. There will be a post for AJ's episode where you can leave some comments, suggestions, feedbacks, or otherwise, and to find those contact points online. Again, over at passionatepioneers.com. Well, we're about to wind this one down, AJ. One heck of a conversation, an exciting one of all the things happening in your team's camp. But before we let you go, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I wake up every day determined to expand access to care and find ways to leverage technology to deliver that care.
I love it. Well, AJ, we know how busy you and the team are, so thank you so much on behalf of our community that has rallied around the podcast. Thank you for taking the time to share kind of your journey and where you and the team are at today and heading tomorrow with Telemed2U, an exciting opportunity right now to engage with you and the team. So again, thank you for taking the time to be with our community today. We really appreciate all of the information and all the things that you shared about what you and the team are doing today and tomorrow. We appreciate you taking the time to be with us today.
Thanks, Mike. It was a true pleasure. Thanks for having me.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.